Dr. Kurt Garrett here on AM Buffalo to talk to us about a new survey and what it means for COVID-19 in 2021. Dr. Kurt, welcome to the show. Thanks for joining us.
It's great to be with you.
So this new survey, what have you found are the biggest takeaways from it that, are really going to impact us?
Well, the Society for Cardiovascular Angiography and Intervention conducted a survey in May of 2020 and learned that an alarming percentage of Americans were saying they would not only avoid doctor's visits, they wouldn't even go to an emergency room if they thought they were having a heart attack or stroke because they were so afraid of COVID-19. We repeated a survey in December to see if things have changed. And I'm happy to report that fewer people are saying that they would stay away in those dire circumstances. And yet, an alarming 1 in 4 Americans still says they will not go to their doctor's appointments because they don't want to get infected. And if you look at African American populations and Latino populations, what you find is that number jumps to about 45%. So I'm very alarmed and very concerned that we haven't done the job we need to do to reassure Americans that we know how to deliver healthcare safely in the doctor's offices, in the medical aid units, in the hospitals, even the emergency rooms. They should not avoid needed care out of anxiety over COVID-19. We're hearing that COVID-19 has become the leading cause of death in America, and that's tragic. But let's not forget that in other circumstances, cardiovascular disease holds that unfortunate title, and cardiovascular deaths and injuries do not stop happening in the background. We've seen now an excess in mortalities over the course of 2020, many of them attributable directly to COVID-19 infection, but some have been attributable to heart events, strokes, and the like that occurred because of disruption in normal care. And that's, in my mind, at least as tragic.
And how is it affecting our friends and family in the Black and Latinx communities?
Disproportionately, I'm afraid to say. Not shockingly, but we know that Black and Latino populations are at particular risk of having heart and vascular disease. There are often access issues and the like that may be impediments to having proper care. That combined now with a certain reluctance about healthcare generally that can exist in some of those communities based on historical events, which I certainly understand, has led some to say, no, I'm not going to go. I'm not going to see a doctor, even though I may feel that I need one. And I'm here to reassure people that healthcare providers know how to care for you safely. And most organizations, I dare say all healthcare organizations, and speak on behalf of Christiana Care, my healthcare organization, we are fully committed to addressing those gaps in care and seeing to it that all populations, all of our neighbors have access to the care that they need.
Is there anywhere we can go to get more information, to get, do more research so we can have that peace of mind?
Well, I'd recommend folks go to secondscount.org. Secondscount.org is a website hosted by Sky. It'll contain a lot of the information people are looking for.